Good evening. Tonight we are going to see one of the important topic about, can anyone guess what is the topic? There is a disease, recently we suffered a lot, COVID-19. So COVID-19 was an epidemic, then it became a pandemic.
Yes.
Are you understanding?
Yes.
So in this class we are going to see, there is a question is always asked in a communicable disease. If they are asking, simply write about the communicable diseases of tuberculosis. You can very well write. How you can write it? You can write it by the agent host environment. That's what you have taken a class, right or not? What is the agent factor? Bacteria. What is the virus? What is their shape? What is the gram positive or gram negative? Where they live? Sporadic or how it will be living? Everything about the virus. That's called the agent factor. Then will be host. Host is the factor, is the person. Who is the new person? Host may be animal also, children also, or the old age also. Anybody can be a host. Environment. Which kind of the environment the disease is coming? Maybe the slum area, polluted environment, crowded environment. We are so, and then you have to remember any communicable disease, agent, host, environment, and you will be writing about primordial, primary, secondary, tertiary prevention. So primordial, yearly identification, yearly screening, yearly notification, yearly quarantine, whatever it may be. Primordial and primary, more or less you write something, vaccination, screening, everything will be there. Secondary, you will be yearly isolation and yearly starting the treatment. Maybe admit in the hospital and you will be starting with the yearly treatment. Then tertiary will be either you will start with the rehabilitation. What is rehabilitation? It is a social, psychological, spiritual measure, train and retrain the individual to live the maximum potential life. That's what we have done in the COVID epidemic, pandemic, whatever it may be, any disease we are doing. So in the fact is, you will be writing commonly. If they asked for, write it, and then you will write last, after primary, primordial, secondary, you will add some programs. DOTS program, right, or cholera control program, deworm program, according to that RNTCP program. Even in TB you are writing vaccination program, EPI immunization program. You have to add any programs are there here. That's all about introduction. Here is the point. If there is, where I was working in Chennai, that time there was a one girl diagnosed as typhoid. Typhoid one, then it was spread. You know about typhoid Mary? How the typhoid is coming? Contaminated food, water, contaminated water, fecal, orophageal contamination. So what happened? Immediately we not informed. Suddenly municipality people came. How they found out? This typhoid girl maybe went to one clinics. So the clinician informed to the government. So it's a governmental responsibility to take it. There was a 2019, there was an epidemic in Wuhan virus in a Wuhan. Everybody looking at the TV. Suddenly what happened? Sudden one February or March or something. Suddenly the virus started. The people who come from quarantine, whatever they meet, then it started as a pandemic. Are you understanding? When the question is asked, there is a sudden outbreak of cholera, there is a sudden outbreak of a coronavirus. As a community health nurse, how will you investigate? That time you are not supposed to write agent, host and environment. Here we are gathered here to teach you how to write the investigation of epidemics. Before starting that, I will have some questions I will ask and clarify with my students. Can you define epidemic?
Yes, ma'am. Epidemic is a sudden outbreak of a disease condition above what we normally expected in a population or in a community area.
What are the types of epidemics?
There are three types of epidemic: common source epidemic, propagated epidemic and mixed epidemic. In common source epidemic, there are on common source, like in a village, there are on tube well, some people in that village, some people are getting drinking water from that tube well, and the
tube well, from
yes.
the well is infected, common, okay.
Yes, ma'am. Then propagated epidemic. Propagated epidemic means the disease will be spread from one person to another person. It is propagated epidemic. And the mixed epidemic. Mixed epidemic is combined form of common source epidemic and propagated epidemic.
Good. So the epidemiologists will come and investigate it. That's like a epidemiologist load we are going to. Okay, before that I will ask you one question. What is called pandemic?
Pandemic, ma'am, It is nationally means one country to another country. The disease
Throughout
will
the
be,
country.
yes.
Example, anybody can say?
Coronavirus.
COVID-19. What is called endemic?
Endemic means in a particular area.
Particular area.
Yeah,
Can
that
you
is-
tell some examples of endemic in India?
Oral.
Dental fluorosis
Yes,
is a
dental
endemic because people consuming in water. Himalayan region, do you remember any disease? Anything? Himalayan, yes, give her. Himalayan region, endemic?
Goiter.
Very good. We had a endemic goiter because of the ecosystem in the Himalayan region. They do not have a particular mineral called iodine. The iodine salt is less in that particular this one. All people living in that one. That is the reason government has started with the iodine supplement program. Okay. Next we will talk about what are all the risk factors for the epidemic.
Risk factors, ma'am. Overcrowded area, then unvaccinated people who are not immunized,
Those who immunized people will be not immunizing. What will happen? Some people immunize, some people not immunize, some people it will here the herd immunity. Some people may not, but it called the herd immunity, it will be coming.
and
What is
who are not maintain the hygiene.
maintain the hygiene? What is called clinical cases? What is subclinical cases?
Clinical cases means on with an example, one people are getting or suffering in pneumonia and
Pneumonia.
the sign and symptoms is clear, sign and symptoms is expressed like pneumonia patient breathing difficulty, fever and cough. These sign and symptoms we are showing, it is clinical cases. And when we call subclinical means disease condition is present in the person but not showing the sign and symptoms.
It's very dangerous for even the corona patients when they were suffering. When this clinically there is no symptom corona, but when they walk they had a breathing difficulty. Then it is like a false this one. Symptoms and always good to easy to identify.
Yes.
Then once they get the C-reactive protein only they understand that there is something is going on. Understand? Yes, we will come to the point. That is the point is the investigation of epidemics. The investigation of epidemics, first you remember one mnemonics that's called VCDRD. Okay, D you can put a T, 2 over that you can put a 2 and then T you can put the 3. We will tell you what is the mnemonics called VCDRD. Can you explain what is V?
V means verification of diagnosis.
Verification of diseases or verification of diagnosis. What is the main, okay, before going to VCDRD investigation of epidemics, what is the governmental objectives to investigate any disease, epidemics?
Objectives of epidemic investigation is to know the disease, to know the causes of this epidemic, to know the sources, to know the mode of transmission, to implement the preventive measure.
To control the diseases,
Yes.
to give the treatment. That's what the government is investigating. Let us see, the first point is the verification of diseases. How do they verify? Can anyone tell? Yeah,
Yes,
tell.
ma'am. Verification, it is the first step of investigation of epidemic. We have to verify the diagnosis. The patient is coming and the person is coming with a sign and symptoms. Then we have to verify that what diagnosis he will get. The mistake will be arrived that
With a differential diagnosis,
Yes,
mistake. So,
mistakes.
you have to make a confirmative test.
we have to do lab test. Then in clinical, we are told that clinical case we have to checking the sign and symptoms and then we have to give the diagnosis. Proper diagnosis we have to give.
Yes, but the physical examination, epidemiological case sheet, and then we will do the survey and we will do analysis as well as you will confirmative test. If you typhoid, there is a Vidal test. If it is a TB, there is a Montax test. Like that, you will be confirming the disease. Then we see confirmation. What is C is the confirmation. What is the second step is called the confirmation.
Confirmation of the existence of an epidemic. We have to confirm about it is epidemic or not. Like one person is getting dengue and her clinical manifestation is fever. She is night sweating like that. But we are thought that it will be epidemic. Yes.
It may be a TB.
Yes, ma'am.
But
Then we have to confirm that it is epidemic or not.
it is epidemic not by the confirmative test but the epidemiologist with the case sheet and other thing. If we see what is D?
Defining the population at risk.
Define the population at risk. When there was a sudden outbreak of cholera in 1820 in England, they first draw the area map, right or not? And then count the population. How do draw the area map? We'll draw the area map.
Landmarks, roads, and
Landmarks, roads and houses will be temples. Then they thought that there is a well, trees, well, iconic schools, mosque, churches. So in the temple, in the well, then they have marked who and all getting affected. They collected the address, they marked the cases. They saw that the cases are around the well. So the epidemiologists went to investigate at the house. What they did, the first they source reduction. Immediately they closed the well. The cases has been reduced. That is the difference between the doctor and the epidemiologist. The doctor, when you go, he will treat, investigate you. What is, are you having fever, vital signs, what is your blood values? But when this communicable disease coming to that, they will refer to the primary healthcare center or the ICMR, the information will be going. From the ICMR, the doctors, epidemiologists will go and investigate. They will stop the diseases spreading to the epidemic or pandemic. Are you understanding? Sometimes that's called the, sometimes emerging and re-emerging the diseases. It will emerge and then it will subside and then it will re-emerge. Are you understanding? Carriers, sometimes will be carrier. Typhoid Mary is a carrier. So they all were suspecting that how these how people are getting this kind of a typhoid. Then they thought that the typhoid Mary do not have a clinical and subclinical symptoms, but she is spreading the diseases. That's also one of the reasons for emerging and re-emerging of the diseases, though we have the many ecological factors and other things. So we have seen the point VCD.
After that
R. What is R?
R for rapid search of cases.
Rapid searches for the new cases. So you will go there, you will ask who came to visit your house. That we have done it during the corona time. We were collecting the number of one person and then who you meet, that number, and from whom how many people has been met. That's why we are tracing with the with the physician, with the doctor, with the trained workers, with the epidemiologist, search for the new cases. What is the purpose of search for the new cases? Quarantine. What is called quarantine? Quarantine is called the limiting of movement. When you limit the movement of the affected person, then the disease spread will be controlled.
Decreased.
So we have seen VCDR. What is D? We will see what is D.
Data analysis.
Yes, data analysis, you put 3 over that. Data always will be analyzed, will be the time, place and person. Why the time, place and person? It can be correlated with the agent, host and environment. Are you understanding? Epidemiology means it's the agent, host and environment. This epidemiological theory talking about the diseases are spread from the transaction between the agent and host and environment. There is a relation and linkage. When you stop it, the disease transmission is stopped. Are you understanding? Here you have to know that there is a 5F in disease transmission. As an epidemiologist, what is that? Food, vomit, finger, fly and feces. Any communicable diseases are spread through the vectors. Who are the vectors? Vectors are?
A rat, then flies.
Rat, flies, mosquitoes, whatever mosquito, dengue mosquito, culex mosquito, Aedes mosquito, anaphyllus mosquito, culex mosquito, elephantiasis. It is live in a dirty water. So there is a source reduction. Whenever there is a model, there was already model control of a dengue, just we all went and helped them to the Tamil Nadu government, the Abadi model for the dengue reduction. Why they kept as a model? This model with the help of collector they will implement. Then if it is good, all the states and all the districts they will be implementing this model, collecting the people who are available from the colleges, volunteers, and each door to door they went and reduced the source reduction. Where the dengue is dwelling, the coconut shell around unclean environment, and inside the fridge clean water also. So they have a beautiful plants and then the clean water is there, refrigerator backside water is collecting. So we all instructed to take a video and show them that reduce the dengue. Understand? So VCDR and D is called data analysis. Again I am telling you time, place and person to relate with the agent, host and environment. Beginning itself I explained what is the agent, what is the host and environment. Which time? Because it's like a winter time, the cholera is more formal. If it is that, you know very well.
You have to identify if it is seasonal or repeated.
Repeated. Sometimes the habit of mosquito, not only dispersal, not only hibernation is the habit of mosquito. This vector will be hibernated in a state of will be in a state, it will be wait for a long time, even 6 months, 7 months, it will not die in the shell. Once the environment is favorable, the mosquitoes will be bloom. So that's why which time the mosquitoes are coming, government has to, epidemiologists will take an investigation, that time precautionary measures, they will clean the environment to do the source reductions. Are you understanding? VCDRD. Next is a
formulation of hypothesis.
Next is a formulation of hypothesis. I have to test the hypothesis, right or not? What is the she is telling, ma'am, dengue is coming. Yes, dengue is coming in the period of rainy season. I cannot tell yes. It is the research. It is the question which is asked to test the hypothesis. I have to answer this. What is research? It is a systematic method and systematic process and discipline method to answer the question. And even dengue is coming in the month of June, July. I cannot tell yes or no. As a researcher, as a epidemiologist, I have to tell I have done an investigation. As a research, I have done a retrospective research, I have done a prospective research or analytical research I have done. So this many years, this many cases were there. Are you understanding? It is a systematic process and discipline method to answer the question. How do I do? Answer. I do the statistical and put and testing. That's called the
testing of hypothesis.
Testing of hypothesis. Yes. Then you have asked the question, is the dengue is coming in July? I test yes. It is coming because this many years it has got done. I have done an analytical study or retrospective study. The dengue is coming. So that's called the testing of hypothesis. After testing of hypothesis finished, investigation. What is the next step? Evaluation of ecological factor. We have done agent, host, environment only. Here is the factor. There are some diseases. In the beginning of my class, you might have understood endemic goiter. So why the goiter is coming in a Himalayan belt? Because of the soil, because of the environment, because of the ecosystem. I have taken a Malda mango seed. I have planted in Tamil Nadu. It is not coming. I put everything. Because of the ecosystem of the Malda, it is a particular for, what is the name of the mango we are very famous, I ate? Pujli. The Pujli mango, Pujli mango. Pujli mango is not coming in Tamil Nadu. Why? Because of the ecosystem. So that is the thing. Some ecosystem, that mud do not have some of the minerals that need. So always epidemiologists will be investigating the ecosystem. That's why in a nutritional assessment, I always tell A, B, C, D, E, F of nutritional assessment. Are you understanding? What is E? Is a ecosystem. F is a functional. A, anthropometric. B is a biochemical, clinical. D, dietary analysis. E, ecosystem. F is a functional. Are you understanding? This nobody will be teaching you. So the epidemiologist have to think in a broader mind than the doctor. Because he is not dealing with the individual, he is dealing with the community. He is responsible for our country's economy, GDP, how much I am spending, what is the statistics, health statistics, right or not? NFHS, National Family Health Welfare. What the statistics epidemiologists holding in the hand to reduce. They do lot of researches through the ICMR, IPH, many Gandhigram. They are doing many researches. Yes. Then next is after
writing the report.
Write the report. How do you write the report? From the beginning. What you have done, the report. What is the exam you have done? What is the test you have, confirmatory test? How many people has done? How many surveys you have done? In that, what is that find out? What is the exam? What is the comparative study or correlative study? In that, how seriousness of this problem? That is the report. Whom they will give the report? The report will be go to the government. So the government will be making a policy or making a vaccination schedule and the further development of the program government will be doing. So hope the viewers, you understand. She will be narrating the whole step VCDRD now. Please listen carefully before winding up the video. Can you explain what is VCDRD completely? Just list down with the V.
V, verification of diagnosis. Then C,
verification of disease. not a
Disease.
diagnosis. First verification of the disease.
Then confirmation of the existence of an epidemic, then defining the population at risk, then rapid search for all cases and their characteristics, then data analysis, then formulation of hypothesis, testing of hypothesis, evaluation of the ecological factor, and then writing the reports.
So defining the population, do thing. How will I define? Draw the area map and count the population. Another
and
D is the
data.
3. Time, place and person, which will be doing with the agent,
A
host and environment. So whenever the question is asked, epidemiology of, investigate the epidemiology of cholera, investigate epidemiology of COVID, investigate epidemiology of malaria, typhoid, dengue, please do not write causative organism of dengue, agent host. This is the steps for writing the investigation of epidemics. All of you understand?
Yes, ma'am.
Okay, thank you. Please see, subscribe and share the video to improve the nursing for people's knowledge. So simple. So learning should be enjoyable. Thank you.